Your surgeon said there's nothing that can be done. The physical therapist said that with rehabilitation, you'll be 100%. Time has passed and you still have foot drop. Then this video is for you. First, let's talk about orthoses, when to use them and for whom. Understand this. Your foot no longer lifts and it still has strength to push down, which is the case for most patients. This causes a deformity in your foot. You have strength to press down, but not to lift up. Your ankle starts to shorten. So everyone with a more severe foot drop who can't lift their foot should use an orthosis. Use it during the day and at night. It doesn't have to be 100% of the time. You don't need to wear the orthosis in the shower when you bathe. However, it's not good to spend many hours with your foot down and not using the orthosis. If you start to feel pain in your heel when you step on the ground in the morning, or if you begin to feel pain on the top of your foot because it feels like everything is loosening, that's a sign of deformity. The back part of your foot is very strong and the front is very weak. It's a sign that you urgently need a good orthosis for your foot, even if you're going to have surgery. Physical therapy is for everyone with drop foot, because even if your drop foot won't improve due to a very severe nerve injury, you still need to strengthen your leg, thigh, glutes, and lower back. For those of you who are improving, it's even more important because it will help your nerves recover again. Just be careful about one thing. There are some items I prefer you remove from your physical therapy. For example, strengthening the calf, stretching the foot downward, and when you use electrical stimulation, avoid applying it to the back of the calf. On the anterolateral part of the leg, yes, because it will make the muscle that lifts the foot stronger. If your injury is very severe and you apply the electrical stimulation to the front part of your leg, you increase the intensity, you don't see any movement, so you increase the intensity again, still no movement, then you increase it even more, and the foot starts to point downward. That means the energy has shifted from the front to the back of the leg, and you're stimulating the calf muscles that pull the foot downward more than the ones that lift it. This will actually make your condition worse. So physical therapy needs to be done the right way. If your physical therapist doesn't understand this and is doing some things wrong, be suspicious. Finally, surgery. Who is surgery for? If your fibular nerve or sciatic nerve injury has no expectation of improvement, in other words, it's a serious injury, and you know that just doing physical therapy and using an orthosis won't solve it, then this procedure might be for you. Understand this. For patients with mild injuries who've only had them for a few months and are improving, we wait for rehabilitation and use an orthosis. If the patient is not improving, the tests show a serious injury, and a lot of time has already passed, this patient needs surgery. Depending on the case, you can address the nerve, or in some cases, you might need to perform a tendon transfer right away. The important thing is, if you want to improve this condition and it's a very serious case, you need to undergo surgical treatment. If you don't have a specialist yet to follow up with you, who has explained what can be done and how serious your injury is, get in touch with us. Schedule an appointment, it will be a pleasure to evaluate you.